Okay, we're going to talk about the heart, of course, a very, very, very important organ of the body. Of course, we need it in order to survive. Some organs, of course, obviously we can live without. There's been people who have splenectomies, removal of the spleen, maybe partial removal of lungs, removal of maybe like one kidney, and so on and so forth. But of course, we need the heart. All right, heart is the pretty complex. A lot of things going on here. All right, so I'll probably talk a lot here, whatnot, right? Okay, so you have what's known as the inferior vena cava. That's blood coming into the heart from the bottom, inferior, kind of coming from the bottom in vena cava. So that's basically deoxygenated blood. And again, here again, the color blue, but the blood is not blue. It's just represented as blues on the diagram, but actually the color is more so of a dark red color. But you have the inferior vena cava, and coming from the lower part of the body, kind of the torso and the lower part of the body. And you have the superior vena cava, where blood is deoxygenated blood is coming into the heart, specifically into the right atrium. Okay, from both the inferior vena cava and the superior vena cava. So both of these vessels are actually going to dump blood into the right atrium. And then from the right atrium, what's going to happen is this: you have muscles around here that's going to contract, and it's going to send the blood through the atrioventricular valves. These are tricuspid valves. Tri meaning three, so it's kind of a three-valve system. So it sends the blood from here into the right ventricle. All right, and that is connected, okay, by papillary muscles located in the ventricle of the heart of the tricuspid valve. All right, and the bicuspid valve of the heart. So you have what we call the chordae tendineae, and that's just actually kind of tendons that help actually open up the valve and shut it, open up the valve and shut it. Why? Well, what's very important is that when the blood flows here from the right atrium into the right ventricle, you want the valve to close up. You don't want the blood to go back from the right ventricle back into the right atrium. There are some issues in which that happens with people, and they have to get a valve replacement. Okay, so you want the contraction of the muscles here, all right, here, the right atrium, push the blood into the right ventricle, close things up, all right, and then from here, it's deoxygenated blood, so it's supposed to go through, all right, what's known as a pulmonary trunk into the pulmonary arteries. All right, so from the right ventricle into the pulmonary arteries. All right, and pulmonary arteries, when you think of pulmonary, you think of the lungs. All right, so this blood is going to take the deoxygenated blood. It's going to go into the lungs. They are carrying carbon dioxide, so red blood cells are going to drop off the carbon dioxide. That's what we exhale out, and they're going to absorb oxygen. All right, and then they're going to return, all right, back into the heart through the right pulmonary veins and the left pulmonary veins. Okay, so they're going to return back to the heart oxygenated, okay, a brighter red because they receive oxygen. So you have the blood coming from here, from the lungs into the left atrium, and then it's going to go through the meter valve, okay, it's a bicuspid valve, into the left ventricle. And as you see, just the muscle structure of the left ventricle, it's pretty thick. I mean, out of all four ventricles, of course, we have four ventricles: right atrium, left atrium, right ventricle, left ventricle. The left ventricle has the largest muscle mass because it's going to be doing most of the pushing, basically to push the heart, to push the blood throughout the body. And actually, what happens is that once the blood is in the left ventricle, it goes through another valve, here into the aorta. Need to use another color obviously, into the aorta. And then the aorta, actually, we'll get more in detail into aorta probably like next week, but it goes through these little, to these branches where the aorta is going to distribute that fresh oxygenated blood, all right, to the upper portion of the body. And I see how and this is the aorta arch, and it's going to come down, and you see here, and it's going to take that blood into the lower part of the body, that oxygenated blood. Okay, when I was talking about the valve here, this is the tricuspid valve. Okay, so this is the front, all right, anterior, posterior. This is of the heart, kind of like a cross section of the heart. Tricuspid, tri means three. So as you see here, okay, essentially, you know, three valves all working together, all right, opening and closing. Whereas the bicuspid, bi meaning two, all right, both of these guys together, opening and closing. All right, so that's the difference between the tricuspid valve and the bicuspid valve. Functionality, work-wise, does the same thing, but built slightly different. Okay, I just really just kind of showed this because when we talk about heart attacks or MIs, what happens is this. Because the heart is a muscle, all right, it's a cardiac muscle, and basically like all cells, including of course muscle cells, they need oxygen. So what happens is that the heart does not get oxygenation from the blood while it's in the chambers really so much. It's from the coronary arteries on the outside. And sometimes what happens with these coronary arteries that's on the outside, which the arteries actually will change into the capillaries so that you have blood-gas exchange. Unfortunately, sometimes it gets clogged. Once that gets clogged, you have, again, right here, the dying muscle here. All right. And then that's just not good, and that can cause a heart attack. So it's that clog right there in coronary arteries. That's the thing that can cause a heart attack. All right, interesting thing about blood vessels. I mean, I've read different sources about it there, but man, it's pretty fascinating. Over 60,000 miles of blood vessels transport your blood throughout the body, long enough to go around the world more than twice. There are 3 types of blood vessels, and we'll get around to that. I've seen that number, 600,000 miles. I've seen other sources where they stated that it's even longer than that, though. But nonetheless, that's a pretty long distance. That's very impressive that we have 600,000 miles all wrapped up in our body. All right, so just remember that the arteries are pretty much the blood vessels that carries blood away from the heart to the other parts of the body in general. Veins, all right, venules and veins are blood vessels that carry blood from the body, deoxygenated blood, back to the heart. So the artery carries oxygenated blood. Okay, the arteries carry oxygenated blood throughout the body. And then the veins carry deoxygenated blood to the heart so that they can receive oxygen once in the lungs. And the capillaries are simply just a tiny tube. We'll talk about them a little bit later, where that we have actually something that's, of course, that's very important, you know, and that's gas exchange. All right, we actually call it a lot of times a blood gas exchange. Very important. So oxygen and carbon dioxide can be exchanged, okay, through the epithelial cells of the capillaries. All right, the heart wall, you definitely need to know this. Myocardium, endocardium, all right, and pericardium. Notice that they're all in the diums, okay? So basically there's 3 main portions of the heart walls. Again, myocardium, endocardium, and pericardium. All right, and again, like I said, these actually make up the walls of the heart. Again, the heart is just basically one big, huge muscle, of course, with different cells, and they are the cardiac muscles. All right, so the endocardium, you just read through that. It's simply the thin muscle membrane which lines the inside of the chamber of the heart, informs the surface of the valves. Myocardium, the muscular tissue of the heart. So this is like the really big thing of the muscular tissue of the heart. And epicardium, all right, basically a membranous inner layer of the pericardium. So basically kind of really like the pericardium and the outer layer of the surface of the heart. All right, so this is what a normal heart looks like. All right, so here's the pericardium. You can really kind of almost think of like the heart is almost pretty like literally sitting in a sack. Okay, so the pericardium is that bag that's kind of holding the heart. Okay, that's a pericardium. However, if someone has pericarditis, the suffix is itis, which means inflammation of. That's when the pericardium is inflamed and doesn't really feel good. I've had that. It was maybe several years ago, and man, it wasn't good. So it was pretty uncomfortable. I can't remember if I take pills, but I like to exercise. One of my workout regimens was swimming. And I was just doing like lap swimming, a lot of lap swimming, maybe like every other day. And then I started dealing with pericarditis, and I had to stop. I had to rest that. Now, what could have caused it? Who knows? Bacteria exposure, virus exposure. It could have been a number of things there, but basically, again, it's an inflammation of the pericardium. And of course, well, now, you know, it's gone down in my case there, so it's normal. All right, the blood vascular system. All right, so basically, you have, in terms of both veins and arteries, have three layers. All right, tunica externa, that's pretty much self-explanatory, like the external. Tunica media in the middle, and tunica intima, that's in the inside. So as you see here, again, the tunica externa, outside. Tunica media, let's point to the middle part right here. And tunica intima, that's the inner part of the vessels. All right, basically where you have the endothelium cells. All right, so these are like the large veins, all right, and the arteries. So again, the arteries are taking blood away from the heart, oxygenated blood away from the heart. The veins are bringing deoxygenated blood to the heart. All right, so again, I think pretty much just reiterating this, the tunica intima. All right, this is just kind of showing, I guess, like a different angle or a different picture of it. All right, so again, tunica intima, cilia, in the inner portion of the vessel. Again, this is something that we see consistent with the artery and the veins. The media, all right, and the extrema. And this is, again, the media is composed of the smooth muscles, okay? Because, yes, these veins, the arteries will have to, on some level, do some contraction there. All right, so again, the three layers, make sure that you know them, the three layers of the arterial as well as the venular walls. All right, the venules, tunica externa and the epithelium. So the venules are actually, of course, smaller in diameter than the veins. The arterioles are smaller in diameter than the arteries. All right, and they have fewer layers because we're going from, I don't know if you kind of picture this. Gosh, this thing is so hard to control, but going from larger to some diameter wise. Let's say that's an artery. Now we're getting into the arterioles, if you will, and then eventually into the capillaries. Where the capillaries are that so thin where that basically blood cells can only pass through the capillaries, all right, in a single file line, if you will. All right, they're that small, that narrow. And we are with the capillaries, the endothelial cells, as it relates to the capillaries or anything. And this is, again, like I said, where the blood gas exchange occurs. All right, where that basically oxygenated blood is going to come and then it's going to dump off the oxygen, all right, to the cells of the body, and they're going to collect the carbon dioxide, the waste gas, and thus turn it from oxygenated blood to deoxygenated blood. Pulmonary and systemic circulation. Just be real quick. The pulmonary circulation, all right, again, transports oxygen poor or oxygen or deoxygenated blood, all right, from the right ventricles, okay, from the right ventricle to the lungs. So again, it's going to go from the right ventricle, all right, to the lungs. So it went from the right atrium to the right ventricle to the lungs, all right, to the arteries. Now, keep in mind, we're saying, wait a minute, and we call them pulmonary arteries because, again, it's taking the blood away from the heart. Although it's blue, it's the deoxygenated blood. Okay, and then it's going to take it to the lungs, and then guess what? It's going to get the oxygen and then come in by way of the pulmonary veins. Again, the veins are bringing blood, all right, to the heart. So again, you got the left pulmonary artery, you got the right pulmonary artery, because you got the left lung and right lung. So they're going to take the blood, okay, to the right lung, to the left lung, and then guess what? The blood from the right lung, all right, is going to return back through the right pulmonary veins, and blood from the left lung is going to return back to the heart through the left pulmonary veins. All right, so again, the pulmonary circulation, blood from the heart to the lungs and back to the heart. Systemic circulation. Now, this is the portion where now we have oxygenated blood. So now we need to transport that oxygenated blood to the body because those cells are in desperate need of the oxygen. So it's going to go up to the head and upper extremities, through the aortic arch, branching off, going towards the top, and then the oxygenated blood is going to go down towards to satisfy the nutrients, water, and oxygen needs to the lower portion of the body. So again, systemic circulation provides functional blood supply to all the body. It carries oxygen and nutrients to the cells. It picks up carbon dioxide and waste products. Yet again, systemic circulation is the blood flow. Is the flow of blood to all the body tissues except for the lungs. So again, just kind of showing that in red, again, this is the oxygenated, and then when it's dumping off. Now this is what we call the capillary beds. It's dumping off the oxygen, receiving carbon dioxide, and it's going to come to the heart. All right, through the superior and inferior vena cava, and you're looking at the right atrium, left atrium, to the lungs, and so on and so forth. And this is just a picture just showing just blood gas exchange at the capillary level. So again, you get the aortas, like I said, look at the diameter, pretty thick. Arterial, getting thinner in diameter. Capillaries, very thin. And then goes to the venules, and then the veins. So as you see, the diameter is getting back thicker. So that's going back to where? It's going back to the heart. Again, this is just a picture just showing blood gas exchange. I think we talked about that already. And then the vasa vasorum. This is just simply a thing where guess what? The vessels themselves need blood. So what happens is that you have these vessels, capillaries, on top of the blood vessels, kind of like the larger blood vessels, to make sure that they actually receive their proper nutrients in order to survive and function correctly as well. All right, it's another picture of what they simply look like. I don't know if this works, but all right. so that they are able to irradiate and distribute blood for these vessels, for these cells, because of course these bunch of cells that make up the vessels, for them to survive, get oxygen, release carbon dioxide and other waste products. All right.